I'm going to take you through how to inspect your arm for early signs of lymphedema. If you already have signs like a feeling of heaviness, tightness, numbness, pins or needles, it's time to seek a referral to a lymphedema therapist. Before we get to inspecting the arm, I'm just going to show you a couple of tests. So the first one's called pitting edema, and the second one is a pinch test, both evidence-based. So pitting edema is if you hold your thumb in, so you can see I'm holding in quite a dent, and you hold it there for 30 seconds, and then you release it and you see if the skin springs straight back. If there's a bump and it stays in there, that is an early sign of lymphedema, and you would need to seek referral to a lymphedema therapist for management. Another test is the pinch test. So that is finding a couple of places, one on your forearm and one on your upper arm. So feeling between the two sides to see if the side that is at risk of lymphedema feels thicker or firmer. So this was research done in 2020, and they found that it correlated quite well with early lymphedema. So it's a good habit to start even before you have surgery, so that you can feel the difference, because there will be a difference. You know, if you're right hand dominant, it's probably going to feel a bit thicker anyway. So, but getting into a habit of just regularly having a feel, and if it starts to feel different, seek referral to lymphedema therapist. Now we're going to get on to actually inspecting the limb. So we'll start right with the fingers. So you can have a look at your fingers. Do they look the same? And then looking at the back of the hand, the tendons. Can you see the tendons visibly on both sides? So if the tendons weren't clear on the back of your hands, on the back of the hand at risk of lymphedema, that would be something to go and see a lymphedema therapist. You can look at the bony bits at your wrist. Do they look the same? Can you clearly see those bony landmarks? If not, go see a lymphedema therapist. You can start having a look at the shape of your forearms. Do they look the same, or is the side at risk of lymphedema look like it's got more of a bulge and a curve? It's a bit hard to see here. That's something you can look at. Looking at your elbows, can you clearly see, your pointy elbow? Again, if it's not clear, that's a sign of some lymphedema, time to see a lymphedema therapist. So you can have a look at your upper arm. You can stand in front of the mirror here. Does the arm at risk of lymphedema look more curved or hang a lot lower? That could be another sign. Even round here, that's a common area where some swelling will accumulate. You can also get breast lymphedema. So signs and symptoms of that might be, discomfort or pain, or it just looks visibly swollen. If that occurs, it's time to see a lymphedema therapist.